A very good afternoon, all of you. Today, the topic of my presentation is introduction of implants. Now, what is implants? Implant is a prosthetic device or an alloplastic material implanted into the oral tissue beneath the mucosal or an periosteal layer or in the bone to provide retention and support for a fixed or removable prosthesis. So it is kind of an anchorage which is implanted into the bone, into the alveolar bone, if you talk of specifically dental implants, to give you retention for the overlying prosthesis. This is what implant is. So how does an implant look and what are the basic parts? The part of the implant, as you can see in the picture, some part is placed in the jawbone. The other, which will, the substructure is the part of the implant which will bear the prosthesis, or that is on which the prosthesis is attached, that is the crown. So these are the three basic parts of implant. If we go into a brief history of implants, they were like, it has been centuries back that implant in one form or the other were introduced and have been used. Okay. But when we talk of the history of implant, the basic revolution which occurred in dental implants was by the scientist Brenmark, as we all know. So let's talk of the treatment options when we talk of implants. Implants can be single unit, teeth missing or multiple teeth missing. In either cases nowadays, with the recent advancements and development, you can use implants. If it's a single or multiple missing tooth, whatever it is, then implant again has the sub options of being a removable partial denture attachment or a fixed partial denture attachment. When we talk of removable partial denture and we compare it with implant, we will find the disadvantage in removable partial denture is these are difficult to maintain. They do not provide good aesthetics. Bulk of RPD is needed because, as you all know, being final year students, that there is acrylic on which the teeth, artificial teeth, are supported in a removable partial denture. So the prosthesis as a whole is bulky. Food debris and plaque accumulation will be there on the acrylic surface. The movement of the prosthesis can take place during speech and function. And there can be loss of abutment teeth on which the removable partial denture is getting its support from, right? So these are some of the disadvantages of a removable partial denture. The fixed partial denture also comes with its own complication. You all know what are the parts of a fixed partial denture. There is a healthy tooth, and then there is a crown. And in this picture, you can see dental implants being used as abutment. But when we do a fixed partial denture as a tooth, fixed partial denture, then the tooth are prepared as an abutment. What are the disadvantages of fixed partial denture? The disadvantage would be, since you are preparing teeth, there can be caries and endodontic failure of the abutment teeth. Increased plaque retention can take place. Damage to the healthy teeth, of course. The tooth you're preparing and using as an abutment can be a vital tooth also. Fracture can take place as a disadvantage. Aesthetics is a little compromised if you compare to implants, and uncemented restorations cannot be done. So these are the disadvantages of fixed partial denture. Also, fixed partial dentures are they are contraindicated in poor abutment teeth support, inadequate hard and soft tissue regions. Sometimes patient desire can be a contraindication, and large patients, as we all know, have large pulp horn and therefore FPDs are contraindicated. What are the advantages? Now, I've mentioned you about the disadvantages of RPDs and FPDs. So why to use an implant? The implant is basically a conservative treatment. Number one, you are not touching the adjacent teeth. There is no abutment needed in an implant. Yes. Then there is better prognosis because you are using the bone as a support structure. And that's why the implant becomes more of a treatment choice and has better durability than FPDs and RPDs. Because FPD and RPD are mainly making use of what is there in the oral cavity. But implant is not gaining any support from the intraoral structures. Rather, it has a strong hold or a strap or strong anchorage, or which we call as the osseointegration. It is osseointegrated to the bone. Adjacent teeth do not require splinted restorations. Implant is an independent restoration, less of caries, less of endodontics, less of porcelain fracture, less of uncemented restoration, less of fracture of the tooth. Psychologically, it is more beneficial for the patient because it gives a new tooth like feel. There is improved hygiene, less decay, therefore, and less pontic overhang. Also, there is decreased cold and contact sensitivity in implants, which you can commonly see in FPDs. And also, wherever there is a direct retainer given in the abutment tooth in RPDs, there also over a period of time, increase in cold and contact sensitivity can be seen. The treatment options for, if you talk of a completely dentulous patient, you usually, as you all know, give complete dentures. In case of implants, you can give implant over dentures in a completely dentulous patients. Implant, if given in complete denture patient, they maintain the bone, they restore and maintain occlusal vertical dimension, they improve phonetics, they improve occlusion, they reduce the size of the prosthesis, they are more psychologically beneficial for the patient, they give good facial aesthetics, and they are more permanent replacements than complete dentures, the conventional complete dentures. So implants in edentulous patients with poor oral muscular coordination, hyperactive gag reflex, or single tooth loss, or where we want to avoid preparation of sound teeth, where there is unfavorable number and location of abutment, patient requiring long span FPD, there you can give, and partially edentulous patient also can treat good patients for implants. Okay. When you talk of the attachment mechanics of implants, you have to consider something, some of the common concepts like the Brenmark's concept and the Wies concept. The Brenmark concept is very well accepted worldwide and is known as osseo integration. And the Wies concept, which was fibro-osseous integration, did not become much popular, but is also one of the concepts of explaining how does a foreign body implant, which is the implant, is accepted into the body, into the jawbone or your alveolar bone. So discussing about the attachment mechanics of implants, osseointegration is bone when there is bone and implant integration. That is, bone is laid very close to the implant material without an intervening, without any intervention of the connective tissue. Okay, and this is known as osseointegration. The bone implant connection is basically known as osseointegration. But if we talk about the Weiss theory, he said there is some amount of fibrous tissue formation around the implant. And this fibrous tissue also helps in attachment or integration of the implant onto the bone. I'll not go into the detail of mechanism of osseointegration because this is more of introduction to implants for you. There are various factors which affect osseointegration, which is like the occlusal load, the biocompatibility of the material you're using as implant, then about the implant design, the implant surface, the surgical site where the implant has been placed, the infection control. These are various factors which affect osseointegration. Dental implants, like I have started the topic, that they are substances that are placed into the jawbone to support they are kind of an anchorage to support the crown or fixed or removable prosthesis. This is how it looks. Where are the dental implants indicated? Now let's talk about the indications. Completely dentulous patients, partially dentulous patients. Even in case of maxillofacial deformities, nowadays dental implants are being used. Patient desire is also one of the indications. If the patient wants implant, single tooth replacement, multiple tooth replacements. Where they are contraindicated is very important because there are a lot of systemic disease where implants cannot be placed. Also, patient compliance becomes very important. It's not like dental implant is the treatment. It is one type of prosthetic treatment which has better prognosis and durability in certain situations or in certain patients compared to other treatment modalities. So, irrespective of how good the implant has been placed, how good the osseointegration has taken place, the patient has to follow hygiene protocols like any other prosthesis, or in a mouth without prosthesis also. Okay, so patient has to maintain their hygiene in all types of treatment. Patients with uncontrolled diabetes and chronic steroid therapies, high doses of radiations, these are certain absolute contraindications. Smoking, alcohol in excess, these are also some relative contraindications. The advantage, like I said, of implant is there is preservation of bone, improved function, improved aesthetics, better stability and support. The need is yes, and like any other treatment, it does require a lot of patient cooperation and implants because they are at present and in today, currently one of the best treatments. So they are expensive. If we classify, let's talk of the classification of implants. They can be epithelial, transosteal, and endosteal implants. Epithelial implants, earlier introduced, basically lie on the epithelial tissue also. Okay, there is not much of depth penetration of the bone in epithelial implants. These are also known as subperiosteal implants. Transosteal implants, on the other hand, are through and through implants, and therefore they penetrate the cortical plates and pass through the entire thickness of the bone. Endosteal implants are more like root form implants, which are to a certain depth, they are drilled or penetrated into the bone, and they usually cut through only one of the cortical plates and are not through and through cutting the cortical bone. Depending upon the material, implants can be metallic and non-metallic. Nowadays, non-metallic implants like PEEK, polyether ether ketones, and ceramic implants and even zirconia implants have been introduced. But initially and by far large implants are made up of the biocompatible material, titanium and its alloys. Implant are of course to improve their osseointegration, to improve their prognosis, are surface treated as well. Parts of the implant, like I've shown you, the basic parts being the implant itself, the abutments, and the prosthesis. Apart from that, healing caps and impression post are also used. The implant body, the complete implant, and healing screws are also used for various phases of implant placement. This is the implant parts. If we talk of the requisites of the implant, we have to achieve osseointegration in dental implants, and that is very important. It should be sterile, biocompatible material. It should have initial stability, very, very important. Non-functional load during the healing period, and inserted into an atraumatic surgical site and by atraumatic surgical technique as well. The peri-implant mucosa is the mucosa surrounding the implant. I'll not get into detail. Okay, there are various differences between your periodontal ligament and your peri-implant tissue. When we talk of implant surgery, the implant surgery is conventionally done in 2 stages. The first stage is when the implant placement into the alveolar bone is done, and then you close the flap. And in the second stage, you reopen the flap and do the prosthetic rehabilitation. And when you talk of prosthetic rehabilitation, of course, you will have to talk of the good amount of gingiva surrounding that implant, your periodontal tissue surrounding the implant. Then you will have to give use impression post, as I showed it in the parts of implant slide. And then you have to take the impressions with the help of impression post and then get the prosthesis fabricated in the dental lab. There are, yes, one-stage implants present these days, but how successful one-stage implants are and not, it is also a depth to be studied in depth. And then you can tell about the success of one-stage implants, or also known as the immediate load implants. You can talk about the success of these implants by your own practice and development of skill over the period of time, right? So there are immediate implants, one-stage implant, two-stage implants. Two-stage implants, like I said, these are the conventional implant placement techniques. So the first stage will include the steps such as the flap design and incision, the flap elevation, the implant placement, the closure, and the post-operative care. This is a pictorial depiction of a single implant where A is the incision and flap elevation, B is the implant placement, and C is then suturing of the site. And what you can see in this is your healing cap. I'll not get into the details, okay, of flap elevation and how it is the placement is done. But you use drills, and with proper irrigation and proper sterilization and asepsis, the whole technique is undertaken. This is how the implant looks after its placement, and usually placed at the level of the crest. Closure of the flap is usually done with the mattress technique or continuous sutures. This is an implant placed into the oral cavity with a healing cap. Post-operative care after implant placement is important. You usually prescribe antibiotics. Ask the patient if there is inflammation. You can ask the patient to keep ice packs. Also can use mouth rinses, that is chlorhexidine, gluconate. Any therapeutic mouth rinse can be used. Patient is asked to keep on a soft diet. Also, if the patient is a tobacco or alcohol user, then they don't have to use it for some time. Oral hygiene instruction becomes important. When we talk of the second stage is to take place when you reopen the suture site, that is the site of placement of the implant, and then you can, the suprastructures of the implant are attached and changed. So this is a pie diagram kind. of not a pie diagram. This is a diagram to explain the various stages. Okay, so you extract the tooth. Then first stage is the implant is placed and submerged under the gums. Then after 3 to 4 months, you do the stage 2, in which you can place the healing compartments. Healing compartment, if it is a posterior implant, then it can be placed in the stage 1 itself, like I have shown you in previous pictures of implant placed with sutures and with the healing compartment. And then after 2 to 3 weeks of the stage 2, you will rehabilitate the implant with the help of a crown. I'll not get into the detail of the flap and flap design. Okay, there are partial thickness flaps, full thickness flaps, whatever is required has to be used. Post-operative care, of course, requires good oral hygiene maintenance, antibiotic coverage, rinsing of the mouth, reframing, refraining from use of alcohol and tobacco, and all the care. Okay, and soft diets. This is a good picture to explain you about the post-operative care. You cannot have hot drinks and excessive hot food. No strenuous exercise means the patient is usually instructed not to sneeze very vigorously or open the mouth or rinse the mouth very vigorously. If there is swelling, you have to keep ice packs. You do give medication to the patient like the antibiotic and analgesic coverage, no alcohols, no smoking, etc. One stage technique, I'll not get into the detail of one stage technique. Now let's talk of peri-implant complications. Peri-implant complication is peri-implant complication. Around the implant, if there is any disease or if there is any factor which causes failure to the implant or makes the prognosis of the implant poor, will be called a peri-implant disease. That is any pathologic changes in the peri-implant tissue. Peri-implant disease can be peri-implant mucositis, so that is inflammatory change around the soft tissue surrounding the implant. Peri-implantitis, which is progressive peri-implant bone loss in the conduction of the soft tissue. The etiology can be the bacterial infection, biomechanical factors, and parafunctional habits. These are the main categories of cause of failure of implant or development. Not, let's not say failure of implant. The implant may survive, but mainly development of a peri-implant disease. So bacterial infection. Secondly, biomechanical factors is that implant is placed in a poor quality bone. The dentist or the operator did not evaluate the bone quality properly before placing the implant. Implant position was not favorable. Loading was not favorable. Parafunctional habits will be such as, that is, if there is the patient parafunctional habit can be such as that if a patient is a bruxer or if he has a chronic clenching habit, then other causes. The fourth point here is the traumatic surgical technique, like proper irrigation was not done during the surgery. Fifth point will be compromised host response. The patient system itself did not respond properly. And last point will be that patient compliance, that is, patient did not follow the instruction of not smoking and alcohol use. Okay. Technical implant failures will be the category of failures in which the abutment loosening and fracture can occur, or there is aesthetic complication. Okay. So I think this is all about how do you maintain. If you talk of if there is failures, you have to consider occlusal therapy. You have to consider changes in prosthesis design, improvement in the implant number and position, occlusal adjustments is very important, but this is pre-surgical. And anti-infective therapy is also, in some cases, it has to be considered. Then after surgery, post-operative local removal of plaque is important. Regular cleaning becomes important. Mouth washes become important. Antimicrobial therapy, that is antibiotic coverage, becomes important. This is a good picture showing how the implant under surface of a prosthesis is being cleaned with the help of a cleaning instrument. Okay. As the dentist, you should always make sure that you keep on recalling the patient, or follow-up becomes very important after implant placement. It is not like you place the implant and then it's goodbye. You have to do regular checkups and regular follow-up to the patient, at least after some time, once in 3 months. And this will also help in monitoring of the plaque level, soft tissue inflammation, and changes in the bone level, if there are any in your implant patient, if the patient himself or herself misses it. Okay, so you are the one, as a dentist, you are the person who is responsible for maintaining good health of the oral cavity of the patient after the placement of implant as well. Apart from patient's daily important daily basic care, you should also show interest and do regular follow-up of the implant patient. So this is all about implant and introduction to implants. Have you taken up the attendance CR?
Yes, ma'am.
Right, you can send me the attendance.